there are certain foods which can trigger a migraine. So is it the food that's doing it, or is it something in the food, or it's how the food is actually being metabolized?
I would say migraines are among the worst condition that people can suffer from. Mm-hmm. But from a functional medicine perspective, they're probably the easiest things to treat. Wouldn't you say, Dr. LePine?
Absolutely. Yeah, exactly.
So how do we think about this condition in traditional medicine? What is the normal approach to diagnosis and treatment, and what's wrong with it?
Well, the interesting thing is when I look back, I can remember when I was practicing mainstream medicine, I always looked at migraine patients. And there were so many different things that were offered by mainstream medicine for migraines. And it sort of made me question, there's no such thing as one migraine. There's so many different flavors of migraine. Mm-hmm. You can have a patient who has periodic migraines. You can have someone who's got menstrual migraines. So to me, that was telling me that migraines, there's a lot of pathways to developing what we call a migraine, or another, they also call it a vascular headache. And I found it really is an interesting approach to know that each individual, their presentation for migraine is unique. The interesting thing is I would never treat two migraine patients the same because they all have different features.
So that speaks to a very central idea in functional medicine, which is this. Just because you know the name of your disease, it doesn't mean you know what's wrong with you, right?
Absolutely.
You have a migraine, that just describes people who have a certain type of headache with certain types of symptoms like light sensitivity, noise sensitivity, maybe on one side, maybe visual pre-aura symptoms, nausea, vomiting. These are just the typical things. Okay, you have a migraine. And then we divide into classical migraine and this migraine, and they're all just different ways of describing the kind of migraine, but none of them tell you the cause. So functional medicine is about focusing on the cause, which is what you're talking about, these different flavors. And
exactly.
There may be up to 29 different factors that can drive a migraine, and traditional medicine just uses a one-size-fits-all approach.
Yeah. So
what is the typical approach to treating migraines?
Well, in mainstream medicine, it's really just basically abortive therapy. You might take Advil or Aleve or an Excedrin. You might take a triptan. You might take an opioid. Like
Imitrex or something.
Imitrex, yeah, Imitrex, exactly. Or opioids in severe cases, steroids in other cases. So it's basically treated abortive therapy, which is that when you get an attack, you treat that attack. And for people who get them more frequently, it's about trying preventive therapies, and they're all over the place. I found that actually quite interesting when I was looking at, how do neurologists approach migraines? These headache neurology specialists, and they use everything. They throw everything in there. They'll throw in beta blockers. They'll throw in calcium channel blockers.
These are to prevent migraines.
To prevent migraines, exactly. So so the preventive role is really important, I think, because when you look at someone who's suffering from migraines, people can lose a lot of work over migraines. They
debilitating.
It's absolutely, and sometimes for some people, it might be 2-3 days or a whole week that's lost. They're just they got to stay in bed and turn the lights off and just wait till the whole episode passes. And then other medications that are used in mainstream medicine are anti-seizure medications. It's
so antidepressants, seizure medications, blood pressure medications,
calcium channel blockers.
Yeah, all the stuff that they're kind of throwing
antidepressants, tricyclic antidepressants, you name it.
And there's no way to actually figure it out. You sort of it's like spaghetti on the wall. These doctors just try this, try that, try this. And I can't tell you how many patients I've seen who've been through the whole mill of these medications, and it might help a little. It might
Botox. They're using Botox now. They're using botulinum toxin.
Yeah, well, that's just to paralyze the muscles in the back of the head, right?
Exactly. Yeah. Right.
So, and it's a terrible condition. I've had people who've had chronic daily migraines or 20 days a month, and it's just so awful for people.
Especially in women. Women tend to have a little more. I think in general, women. I'd probably see more women with migraines as opposed to men, and then women also get menstrual migraines, which is another sort of flavor of migraines, which is another probably related to estrogen detoxification. So it really is. It really keeps me on my toes in functional medicine when I see a migraine patient, because it's not like, oh, here's your problem, just do this and it's fine. I've got to play detective. I've got to figure out what are the factors that are driving that person's unique presentation of their migraines.
That's absolutely right, because what we do in traditional medicine is, okay, you have this type of headache, and I ask these questions, and it meets these criteria for what a migraine headache is, according to the Neurological Society criteria. But once you make the diagnosis, there's no more thinking involved. It's like, okay, here's the cocktail of drugs I get to pick from.
Yeah.
Let's start with these, try this, that doesn't work, we'll try this. And it's just like, it's kind of a merry-go-round of drugs, and it often is so difficult for people to get better.
Oh, yeah.
Because they're not asking the right questions. So in functional medicine, we don't just name and blame, which is what our mentor Sidney Baker talks. We name it, blame it, and tame it. You name the disease. Say, oh, you have a migraine. That's why your head hurts. No, that's not why your head hurts. That's just the name of why your head hurts.
Yep.
And then we try to tame it with a drug instead of actually figuring out the cause. So let's talk a little bit from a functional medicine perspective about what the causes are. And let's get into some cases, because I think we've both seen so many cases. It's one of the most satisfying things for me as a doctor to actually treat, because it's so easy usually, and people do so well with simple approaches that deal with the root causes.
Mm-hmm. Yeah, absolutely. Yeah.
So tell me what are the things that you think of when you're coming to see these patients that could be driving the migraines?
Well, one of the things that I think is missed by a lot of mainstream doctors, even neurologists, is to understand the role that mitochondria play in migraines. Interestingly, mitochondria, which are the powerhouses of the cell, they basically is where when our body consumes food, we produce energy from that food in the form of ATP. And mitochondria are not really tested by mainstream medicine. They are not well understood. It's something that you learn about in medical school, and then you forget about it. And the interesting thing is that people who have migraines also have a higher incidence of seizures. And that's why, to some degree, anti-seizure medications can actually have efficacy in some patients who have migraines. So there's a real important to realize that connection between mitochondrial dysfunction and migraines.
The mitochondria make energy in your cells. So
make energy in your cells. In fact, I've actually seen some patients, interestingly, who and I don't treat children, but I've seen some adults, when I go into their history, they had a history of what is called cyclic vomiting syndrome. And so that's where a young kid is vomiting for no particular reason. And it turns out cyclic vomiting syndrome is actually a mitochondrial problem. And as a person gets older, they sort of outgrow that vomiting episodes, but they actually then present with migraines. And interestingly, the gut is connected to the brain. So a lot of people can have what we call abdominal migraines.
Yes.
Exactly. Right.
Yeah, this reminds me, Todd, I had a patient who struggled with headaches and migraines, and she had terrible SIBO, which is overgrowth of bad bugs in your small intestine.
Yeah.
It was causing all this fermentation and creates these toxic byproducts that were clearly creating inflammation in the brain. And we treated her gut with antibiotics to cure migraine. But who would have thought of that as a neurologist, right?
Exactly. And it's also the other interesting thing, and we're going to talk about that in one of the upcoming episodes, is on histamine, the role of histamine. And that's actually a very interesting thing when you look at histamine, because people who have SIBO, they actually have bacteria that are producing toxins like you're talking about. And one of the problems is excess amounts of histamine. So normally our bacteria will degrade histamine, and we have enzymes that do that. And there's all these different pathways. And when you look at some people who have migraine headaches, there are certain foods which can trigger a migraine. So is it the food that's doing it, or is it something in the food, or it's how the food is actually being metabolized? So that's a really a key important feature, is that the connection between the gut, our food, and the brain.
Yeah. I mean, it's such a big problem, Todd. You know, the amount of people with migraines, there's over 10 million people have migraines. It costs about $17 billion a year to society in healthcare costs. Just direct healthcare costs. That's medications, emergency room visits, hospitalizations, doctor visits, testing, and then even managing the side effects. And then the loss of productivity to employers, because like you were saying, is $15 billion, about half that's
huge
due to absenteeism, and the other half's due to just people being on the job, but not being at the job, but not on the job. You know, they're just sort of there, but not functioning.
Absolutely.
And so over the years of functional medicine, I've seen so many patients, and like you said before, there's so many different flavors. Tell us about some of the other flavors, because we went through the mitochondria, and let's just go down the list of what are the most common things, because like there could be 29 things, but there's a few that are really common.
Stress.
That are really stress. Okay, tell us about stress and migraine.
So stress by itself does not cause any diseases, but stress can turn the volume up on all different kinds of conditions. We see that in autoimmune conditions. So how our bodies respond to stress, and some people have, I would call it a genetic predisposition to be more stress resilient, and some people don't. And some people are more prone to the effects of stress. And time after time, you see these people who they'll go through a very stressful period, and all of a sudden they get a full-blown migraine. Well, what is that? It's how, what's going on there? And I think it is how that person perceives the world and how they detoxify their stress. Absolutely. And that's why, beta blockers, which block adrenaline, which you get high levels of stress, makes a big difference.
So things like yoga, meditation.
Exactly. And then also sometimes when you have patients who have migraines and you measure their cortisol levels, they've got higher levels of cortisol. So that's telling you they're having some more chronic stress. And there's, they'll be type A, where they're sort of very, very driven, those kinds of things.
So you mentioned gut issues a little bit earlier, and I think that's another big one, and not just SIBO, but there are a lot of symptoms that people get that could be related to leaky gut and food sensitivities, which seem to be a huge factor with migraines that are really undiagnosed. We know traditionally that people say scientists and doctors say stay away from tyramine foods, those things, cheeses, and foods that contain certain chemicals like MSG or aspartame. So there are some recommendations, chocolate, caffeine. There are doctors who do say some of these things, and that can be helpful for some patients. But it goes much deeper than that. There's like food sensitivities and gluten. So tell us about how that works.
Yeah, well, I think that the connection between the gut and the brain is huge, and the leaky gut component. You oftentimes will see leaky gut in patients who have increased risk for migraines. There's definitely a two-way communication that's going on there, and again, sleep is another thing that plays a huge role. So lack of sleep is huge in migraines. So when you look at when somebody comes to see me, I ask them, how's your stress level? How are you sleeping? And what are you eating? And who are you feeding? Which is, what's going on with the gut bugs. Yeah. You have patients who will tell you that when they eat certain types of foods, like sugar, it'll trigger a migraine. Yeah. It's huge. And I suspect that some of those foods are actually affecting the gut microbiome in a very rapid fashion that's causing migraines.
Yeah. One of the biggest things I've seen, I'm sure you probably noticed this too, is that gluten tops the list when it comes to migraines. If anybody has a migraine, the simplest thing to do is an elimination diet.
Absolutely.
To get rid of the most common allergens, gluten, dairy, eggs. And I've seen so many people. I had one woman, she was married to a mafia don, and she had headaches for 40 years, was incapacitated in bed very often. And it turned out that it was eggs. Yeah. Now, we found this on a food sensitivity test. And that's not to say everybody's migraine is caused by eggs, but hers seemed to be triggered by eggs. She stopped the eggs and her migraines went away. Yeah. So I think, everybody's different, like you said. We have to treat the person, not the disease. Absolutely. I think William Osler said that, we should treat the person who has the disease, not the disease that the person has. And I think that's the mistake we make in medicine. So doing elimination diet, getting food sensitivity testing, checking for gluten, that's all important. The chemical triggers, we talked a little bit about that. Talk more a little bit about some of these chemical triggers that we notice with migraines.
You mean like exogenous chemicals?
Things like aspartames, artificial sweeteners, food additives, sulfites, for example.
I would say that those are basically excitotoxins. These are certain types of foods which can cause excess activity, like monosodium glutamate. You get excess glutamine in the brain, because glutamine gets converted into glutamate, which is an excitotoxin. So definitely there are those types of foods. And even if you give somebody glutamine, which we use a lot to help with patients, I've had these patients who they'll metabolize their glutamine directly into glutamate, and taking glutamine will be just like taking MSG. They'll get very agitated and get a headache.
And aspartame is bad. I've seen so many patients who
aspartame,
swig back those diet sodas and
We have somebody in the White House who does I think about 10 a day.
I don't know if he's getting migraines, but he's giving everybody else a headache. But I think I think you're right. I think we have to really look at these things. The nitrates that are in, for example, deli meats, sulfites that are commonly added to salad bars. Just keep the vegetables fresh, or the dried fruit and wine. Tyramine was in chocolate, cheese. These are really significant. So getting rid of all the processed food, all those chemicals, super important. Hey everybody, it's Dr. Hyman. Thanks for tuning into the Doctor's Pharmacy. I hope you're loving this podcast. It's one of my favorite things to do, and introducing you all the experts that I know and I love and that I've learned so much from. And I want to tell you about something else I'm doing, which is called Mark's Picks. It's my weekly newsletter. And in it, I share my favorite stuff, from foods to supplements to gadgets to tools to enhance your health. It's all the cool stuff that I use and that my team uses to optimize and enhance our health. And I'd love you to sign up for the weekly newsletter. I'll only send it to you once a week on Fridays. Nothing else, I promise. And all you have to do is go to drhyman.com/picks to sign up. That's drhyman.com/picks, P-I-C-K-S, and sign up for the newsletter. And I'll share with you my favorite stuff that I use to enhance my health and get healthier and better and live younger, longer. Now back to this week's episode. Let's talk about hormonal factors, because these are really common.
Yeah.
And often, women, we see this whole phenomena of premenstrual migraines. How do you know if this is an issue for you with your patients?
Oh, well, just by history. I mean, the history will tell you that. And I typically will see that those types of patients who have menstrual migraines tend to have problems with estrogen detoxification.
Yeah.
So, as men, our hormones tend to stay relatively stable. They go up in the morning, but they're pretty stable. Women's hormones, they go up and down like the tides. And that's normal. That's part of the menstrual cycle. So when women are menstruating, they have some women have great fluctuations in hormones. And when the body is done with those hormones, unless you're pregnant, the body has to detoxify those hormones. And there are certain pathways that help with estrogen detoxification. And when women have problems with those pathways, one of the genes that's important in there is the catechol O-methyltransferase, or COMT gene.
Yeah.
And typically that gene is oftentimes associated with increased sensitivity to pain. It's also associated with increased sensitivity to migraines, seizures, and headaches.
Yeah.
So it's definitely one of those pathways that you want to support for the detoxification or the methylation of
with B vitamins like B6, B12,
magnesium.
Yeah. And and often the classic story that I've seen with these premenstrual migraines is women get like PMSy symptoms. So they get bloating, fluid retention. They get cravings, irritability, breast tenderness, menstrual cramps, and they get heavy bleeding. And these are signs of sort of too much estrogen and not enough progesterone.
Yep.
And I remember one patient who had a migraine, literally in my office, and I had a sample tube of topical progesterone that I had been given by the company that made it. And I literally said, well, let's just try this. And I took the progesterone. I just put a little cream on her arm, rubbed it in, and her headache went away, like right there in the office. It was the most striking thing I'd ever seen.
Yeah.
And I think, we often will prescribe topical progesterone or other things to help. We'll prescribe dietary changes to help with PMS. It help detoxifying these hormones can be really helpful.
Yeah.
And also using an overall strategy of diet and exercise and stress reduction to balance women's hormones, because I think they're totally influenced by diet, even the microbiome.
Well, it's interesting you say that, because I remember distinctly when I had a patient when I was practicing mainstream medicine who had menstrual migraines, and the only thing that worked for her was Xanax. Now, Xanax is a benzodiazepine, which is a tranquilizer.
Like Valium.
Yeah, like Valium, exactly. And it works on the GABA receptors. And guess what? Progesterone works on that system.
Right.
That's why progesterone is so powerful.
So just to recap that, what you're saying is that basically progesterone is women's natural Valium.
Exactly.
And it works in the brain on these receptors called GABA that Valium works on, and makes you relax, which actually helps women sleep, calms their nervous system, deals with some of this mood fluctuations that happen with high estrogen.
Yep.
And by the way, our whole lifestyle drives estrogen, right? Sugar, stress, lack of exercise, bad gut microbiome, environmental toxins, all these things will drive, dairy, for example, drives excess hormone and estrogen production, being overweight, sugar.
Yep.
All those things can be managed easily with lifestyle and diet.
Yeah.
Okay, let's talk about some of the nutrients, because there are some key nutrients that are often low in people who have migraines.
Yep, absolutely.
What's the number one nutrient that you would be thinking about?
I would say magnesium.
Yeah, magnesium.
Yeah. Now, the interesting thing, this is also another thing where you can sort of connect the dots here, is magnesium, which is such a powerful, it's involved in like 500 enzyme pathways in the body, is magnesium, when you get to a high enough level, is actually a calcium channel blocker. And guess what doctors use to prevent migraines? Calcium channel blockers.
It's a natural muscle relaxant.
Yeah.
It's actually, I remember, when I was an ER doctor, it was one of the things we used. So when none of the drugs worked, we would use IV or intravenous magnesium for migraine patients. Remember that?
Absolutely. And and not only that, but we use in the ER, we use IV magnesium for heart arrhythmias, life-threatening ones like torsade de pointes and VTAC. We also use it for status asthmaticus.
Yeah.
All right. You use it for preeclampsia. It's a very powerful element.
It's a relaxant. And what you're saying is funny to me, because I remember, when you learn these ACLS courses, the Advanced Cardiac Life Support, and how to run a code and bring people back from death when their heart's not working, and they use all these drugs, drug. And the last thing, if nothing else works, they use magnesium. Why don't you use it first? Right? And then, like, if someone's got heart's not beating right, you give them magnesium and it fixes it. Or if people are coming in preterm labor or have like this preeclampsia, which is high blood pressure in pregnancy with seizures, they use IV magnesium. They use and asthma, like you said, to relax the lungs. They use IV magnesium. It's pretty funny. Even for people who are constipated, they give them milk of magnesia. So
exactly.
it's kind of it's funny. Doctors don't really think about it. And most of us, about 40% of us, are low or deficient in magnesium.
Oh yeah.
And I remember this one patient I had who was a radiation oncology resident back when we were at Canyon Ranch, and she was just debilitated with migraines. She had the worst migraines. She was on narcotics and Zofran, which is like a chemo drug that's used for nausea. It was that severe. She could barely work. Yep. And she came to see me, and I started asking her questions. And this is how you find things out in functional medicine. You try to connect the dots. So usually you can find out from a story if it's a premenstrual migraine, if it's a food-related migraine, this is why you're saying we can actually figure this out as functional medicine doctors. And it turned out, I started asking her questions, and she had muscle cramps. She had constipation. I said, how often do you go to the bathroom? Are you regular? She goes, yeah, I'm regular. I said, how often do you go? She was like, I go every week. I said, that's not regular. She says, regular for me. I go every week. Severely constipated, muscle cramps, headaches, insomnia, irritability, anxiety, palpitations, sensitive to loud noises. These were all symptoms of low magnesium. Yeah. And so it turned out she needed, like, normal dose is 200, 400 milligrams. She needed like 2,000, 3,000 milligrams a day of magnesium. And literally her migraines went away. Yeah. And that's sort of her constipation and all those other symptoms. So it's often very simple if you know what to do.
Yeah, absolutely. Yeah.
Are there other nutrients that you would think of that might be helpful? Because you mentioned mitochondria, and there's a couple of nutrients there that can really help.
Yeah, I mean, there's some I think some of the key nutrients are vitamin B2, vitamin B6, and also CoQ10. Those are probably some of my key mitochondrial nutrients that really can have an impact, along with magnesium.
Yeah.